Good day everyone, it's Nurse Christy and today I'm going to show you how to do the basic life support in a Pedia patient. For the assessment, we will prevent an arrest. We will also have an effective advanced life support. We should have an early high quality CPR. We will have an integrated post-cardiac arrest care, and also we will activate our EMS, our emergency medical system, to seek for their help. And we'll also if witness, we will call them first. If unwitnessed, we will provide care first. So for the materials that we will be needing, or the essential materials for this emergency care, of course we need a gloves. We will also need a mouth barrier, and of course a wristwatch. For the planning and expected outcomes, syempre we need to know when to stop. Kung meron na bang spontaneous circulation ng ating patient, kailangan din po nating i-turn over po to sa very well trained medical personnel, and kailangan din i-plan tayo if we the operator become exhausted. So we try to seek help po sa mga nanonood sa atin or nakakita rin ng scene na ito. Kailangan din po natin syempre magkaroon ng plan if the surroundings or the scene become unsafe. And of course kailangan po nating become unsafe, become exhausted, and the physician has already assumed the responsibility of the patient natin. For the evaluation, syempre, we need to document all the things that we done through the patient, of course. And then, syempre, yung nakapag-conduct na rin tayo ng secondary assessment, like kung ano po bang kind na injury na tamo ng ating patient, or paano niya po ba ito nakuha, and kano po ba kalala yung possible na injury na tinatamo po ng ating patient, para pag na-endorse natin siya is can provide a information or a insight sa ating EMS team para ma-determine nila on how to provide the specific care po sa ating patient na nasa emergency situation po. For unresponsive patient, of course, we will call for a help and get an AED. And the second one is simultaneously open the airway with the techniques of tilting the chin and lifting the head. So it should be done without a spinal injury. But kung merong spinal injury ang ating patient, it cannot be undone. So gagamit tayo ng i-modify naman natin yung chest, kanyang jaw thrust if merong spinal injury. Bakit? Kasi hindi natin pwede basta-basta i-move yung head or i-modify siya sa sinasabi nating tilting the chin and lifting the head while meron siyang spinal injury, kasi mas na magkakaroon siya ng harm pa sa patient natin eh. Syempre ayun yung iniiwasan natin, na baka mas mamaya mas harm pa natin yung patient, na ayun nga, binibigyan natin ng life or ng buhay ulit. Hindi naman actually bigyan ng buhay, kasi nire-revive natin or binibigyan natin ng basic life support. So after po natin, syempre sinabi ko na sa inyo, ang compressions natin is 30. So we have 30 compression. It's a 5 cycle continuously. So 30 po siya, 30 compression each cycle, and we will give a ventilation of 2, with the use of pocket mask. So, syempre, pag ang ating patient ay, pangalan nito, is responsive, we will, going to do this, checking of this step, ABC, or the airway, breathing, and circulation. If wala namang, unresponsive naman po ang ating patient, we're going to, ano naman po, by circulation, airway, and breathing. So, mamaya po, oh my God, nakaryante yun. Mamaya po is I'm going to show you how to do the right way or the right placing of hands po while doing the CPR and the high quality CPR po for an effective CPR. So, ngayon po is I'm going to show you how the sequence goes by lang po. So, kasi we have a limited time po. It should be 15 minutes. So, I'm gonna do it later. For now po, I'm going to show you how the sequence goes by. If etong mga sequence na to, it should be follow po systematically, because any missteps or undos na steps natin can lead po sa can be a danger sa ating patient. And alam naman po natin in this kind of situation, an emergency situation, it's very delicate po sa kailangan na pagbibigay natin ng nursing intervention sa kanila, kasi this is a life-threatening, it's a life between death situation po. So, mag-proceed na po tayo sa next step natin, which is maintaining the high quality CPR po with the right placement nga po ng hand and the right location kung saan tayo magbibigay ng compression, and the right way to give ventilation, the right duration and time po. So for the compression or the placement naman po ng hand, it should be placed po on the one hand with below the ating nipple line on the left side, because andun ang ating heart. Syempre, bigyan nga tayo ng pulses para magkaroon po ng electricity or pumping sa ating heart to continuously circulation ng ating puso or the pounding po ng ating puso. So, sa pagbibigay po ng compression sa ating heart, it should be 1 to 1.5 po yung deep po ng pagbibigay natin ng compression po sa ating patient. In the rate po of 100 to 150 beats per minute to allow the chest to recoil, to fully recoil. So, ayun nga po. So, kanina, yung while filming about the BLS with AED, so ngayon naman is it should be 1.5 pala. So, prior to this one, kasi nanood ako, it should be 1.5 to 2 inches deep in giving compressions po sa ating mga pedia. In the newborn, syempre, mas maliit po siya, so it's 1 to 1.5. But this one in pedia, it is a 1.5 to 2 inches po. Sa ating naman pong ventilation, the duration is 1, it should be given to 5 to 8 minutes only. Hindi na po tayo mag-exceed doon, then we'll continue maintaining the high quality CPR. Kasi dapat continuous yun, no interruption. So, if you are if you have a partner on giving a CPR, so, syempre, hindi naman natin maiwasan na we will be exhausted in doing that. So, kung ang ratio po, kung dalawa tayo, is 15 po each. So, 15 to 2, that is equivalent to full compression of 30. So, it should be done nga po in a 5 cycle po. Diba? When a patient po, after we do the cycle, when a patient has spontaneous movement naman po, syempre, i-check natin yung ating pulse ng ating patient every 2 minutes to monitor them. If not naman po, kung wala pa rin pong pulse, sa ating carotid artery is mag-proceed pa rin tayo sa ating high quality CPR po. So for the patient has a pulse na po. So ito na po yung pulse. I-position natin ang ating patient natin to recumbent position. Lateral recumbent position para yung ating 'di ba syempre sa gravity it pulls down everything down to the earth. So pag naka-place tayo ng ganon, syempre yung circulation natin is magka-come back yung flow sa focuses sa ating patient's heart. If the patient naman po has a breathing, has a pulse but not breathing, we will give a ventilation sa ating patient. Every 3 to 5 seconds po, about 15 to 30 beats per minute naman po ito. So, ayun nga po, if the patient has goes back na nawalan uli siya ng pulsation, then we continue the high quality CPR until na manumbalik po yung pulsation ng ating patient. So, ang pag-check natin ng pulsation in Pedia is sa carotid artery po tayo. So, where does it located ang ating artery? Dito, ang artery ay dito, nasa taas siya. Ang jugular vein is superficial, but then the artery is mas nasa ilalim siya ng ang ating carotid artery sa ilalim siya ng jugular vein. So, it is not, if hindi siya palpable, it means there's no signs of pulsation, then we continue nga as I said. Yun na. So, after neto, syempre, for the evaluation, as I said earlier, sinabi ko na siya, but then kailangan nga natin ang secondary assessment to know kung what happened nga po sa ating patient para pag na-endorse natin siya sa ating professional emergency medical system or the medical team, the EMS, is nabibigay nga po yung specific health intervention sa kanya. Kasi like that, so may spinal injury but then di natin nasabi. So as a witness, kailangan natin masabi or mapaliwanag sa kanila na kung paano natamo netong patient, ano yung natamo neto, what kind, anong bali sa kanya, ano po yung things na dapat nating i-focus on delivering the healthcare intervention na po. Diba, as I said, kung di natin nasabi pa sa kanila na ito palang patient na to is meron palang problema sa nagkaroon pa ng spinal injury, syempre itilt pa rin nila yung head nun, and then mas lalong nakakasama nga po sa kanila. So, kailangan natin na secondary assessment or findings para at least hindi nakakapa ang ating mga medical practitioners on giving the specific intervention